and welcome. This is another video on the series of what we can publish in the medical literature. Clinicians in OBGYN will find this useful to understand how they can contribute in this form. Generally, this kind of publication requires a level of understanding of the topic and a level of seniority, as well as an understanding of research guidelines. So to understand the definition of guideline, we find that a guideline is a document that outlines recommendations, protocols, or standards of care for the diagnosis, treatment, management, or prevention of a specific medical condition or health-related issue. Guidelines are typically developed by expert panels or professional organizations, often comprising clinicians, researchers, and other stakeholders with expertise in the topic area. An example of a guideline includes the clinical practice guidelines developed by organizations such as the American Heart Association guidelines for cardiopulmonary resuscitation and emergency cardiovascular care. The development of guidelines involves a systematic review of the available evidence, which includes clinical trials, observational studies, and meta-analysis to inform the recommendations. It may include recommendations on diagnostic criteria, on treatment options, on monitoring strategies, on patient education, or on other aspects of care. The guidelines are usually graded or categorized based on the level of evidence supporting each recommendation, such as a randomized controlled trial offers the highest category or grade of recommendation, followed by observational studies, followed by expert opinion or consensus. On the other hand, a consensus statement reflects the collective opinion or consensus of a group of experts on a particular topic based on their knowledge, expertise, and experience. Consensus statements are developed through a consensus building process, such as expert meetings, conferences, or Delphi surveys, where participants will discuss and reach agreement on key points or recommendations. Consensus statements may not always be based on formal systematic review of the evidence. They may be used to address areas where evidence is either completely lacking or it is conflicting, or to provide guidance on emerging issues or controversies in clinical practice. Such statements are often published in peer-reviewed journals or endorsed by professional societies or organizations to lend credibility to the recommendations. So the question is, why would a medical journal publish guidelines or consensus documents? By doing so, the journal's reputation and authority is enhanced because it demonstrates a commitment to disseminating evidence-based recommendations and expert consensus. Such guidelines and consensus will provide practical recommendations for healthcare providers, for policymakers, and other stakeholders. They help to standardize and improve clinical care and health outcomes. Other advantages include the fact that as these guidelines are often published in peer-reviewed journals, it promotes transparency and accountability because these documents will undergo a rigorous review and scrutiny by other experts in the field. Well-established guidelines or consensus statements will often be cited extensively, and this increases the value of the medical journal in which the article has been published. The publisher also has interest in such documents because they are of considerable educational value and resource for medical students, for residents and practitioners, as they provide evidence-based guidance on best practice, treatment algorithms, and management strategies for various medical conditions. Advantages for a publisher include the following. Developing and publishing guidelines or consensus documents may be resource intensive for the publisher, requiring significant investment in terms of time, expertise, and funding to convene expert panels for review. Journals will also be concerned as authors involved in developing these statements and guidelines may have conflicts of interest, such as financial relationships with pharmaceutical companies or professional organizations. And this could influence the content or even the recommendation. The other disadvantage is that the evidence base for medical practice is constantly evolving, and guidelines may become outdated or obsolete as new research emerges. So publishers have to ensure that guidelines are regularly reviewed, updated, and revised to reflect the latest evidence and best practice. So guidelines and statements may face challenges in implementation and uptake by healthcare providers and organizations, particularly if they are perceived as complex, impractical, or inconsistent with existing practices. Publishers should consider strategies to facilitate dissemination, adoption, and adherence to the recommendation. A simple example of this last point is that even though magnesium sulfate is considered to be an important intervention for prevention of fits in eclampsia, yet in many countries of the world, it may not be readily available for patients who develop eclampsia and are present in the community. An important disadvantage is that by publishing a recommendation or a guideline, the journal may face a legal and liability risk because the recommendation may be misinterpreted, misapplied, or lead to adverse outcomes. And therefore, publishers would like authors to write their disclaimers and caveats regarding their intended use and limitation. Authors who publish guidelines and consensus documents have a great advantage and edge over other colleagues or members. Such publications will lend credibility to the author's level of seniority and of commitment. It also shows the level of the medical professional and the researcher as they can understand the gaps in the literature and the guidance of further work that can be undertaken. It allows authors to improve patient care and outcomes. Other advantages to the authors include networking and collaboration, potential for citations, educational opportunities, and fulfillment of ethical obligations as a clinical professional. Now we will just mention some important and prominent guidelines which are used in obstetrics and gynecology. The American College of Obstetrics and Gynecology publishes guidelines regularly and updates them regularly. They publish on various aspects of women's health, including prenatal care, labor and delivery, contraception, menopause, and gynecological surgery. The World Health Organization reproductive health guidelines on reproductive health topics such as family planning, antenatal care, postnatal care, and the management of obstetric complications is also very well read and followed. The National Institute of Clinical Excellence guidelines, which are published from the United Kingdom, produces evidence-based guidelines on a wide range of healthcare topics, which includes OBGYN. The Center for Disease Control in the United States issues guidelines regularly and updates their guidelines regularly. They cover mostly women's health issues, which include sexually transmitted infections, cervical cancer screening, and preconception care. The International Federation of Obstetrics and Gynecology is an international organization, and they publish on global women's health issues such as the prevention and management of maternal mortality, cervical cancer, and female genital mutilation. The Royal College of OBGYN in the United Kingdom produces evidence-based clinical guidelines and standards to support healthcare professionals in the provision of high-quality care to women. It is very important that healthcare providers should remain updated with the latest guidelines. This will help to ensure they are delivering optimal care to their patients. So textbooks many times become outdated as more and more evidence is accumulated for the benefit of patient care. And this benefit can only be given to the patients if the provider, the healthcare provider, reads, understands, and follows guidelines. At times, some modification may be required in the guidelines, but the modification should not go against the evidence. So here we are going to give an example of a recent guideline that has been published by the European Society of Human Reproduction and Embryology called ESHRE, and they have published a very extensive and exhaustive document on endometriosis. As an example, we will now briefly review the changes to the guideline recommendations as reviewed by the European Society of Human Reproduction and Embryology, or ESHRE. These guidelines were published in 2022. So this recommendation is the update on the earlier publication in 2014. While most of the more recent studies confirm the previous ESHRE recommendations, there are 5 topics in which significant changes in clinical practice are to be expected. So ESHRE has used the grade approach to rate the certainty of evidence which was found in systematic reviews and to synthesize other evidence. And grade means the grades of recommendation, assessment, development, and evaluation. This approach provides guidance for rating quality of evidence and grading the strength of recommendations for the purpose of healthcare. So by strong recommendation, it means that this is highly recommended because the maximum amount of evidence is available for this recommendation. So the strong recommendation is that most patients should receive this recommended course of treatment. whereas a weak recommendation means that there are different choices which will be appropriate for different patients, and clinicians must make a greater effort in helping patients to arrive at a decision consistent with their values and preferences. A good practice point is actually a consensus, and it's a consensus document which informs of the advice of the guideline development group regarding a certain recommendation. There are certain recommendations which are only for research, and this actually comes about because the group that is developing the guidelines has an understanding of the gaps in the research and gaps in the evidence. And so they then come forward with certain recommendations about research that can be carried out. However, if there is any treatment or any intervention in the form of diagnosis or diagnostic test or monitoring, then this can only be done in the setting of a research trial and not in a clinical setting. Because in a research trial setting, there will be appropriate approvals and safety precautions. The target users of the guideline include cover of the care provided by secondary and tertiary healthcare professionals who have direct contact with and make decisions concerning the care of women with endometriosis. So although primary healthcare providers are not the main target users of this guideline, it may be of interest for them. This guideline is of relevance in European healthcare providers and women with endometriosis. So all the recommendations may not be applied so easily in a third world setting or a low, middle and income level setting. So the major changes or which are included in the ESHRE 2022 publication include the diagnosis of endometriosis. Laparoscopy is no longer the diagnostic gold standard and is only recommended in patients with negative imaging results and or where empirical treatment was unsuccessful or inappropriate. Treatment of endometriosis associated pain, the recommendation change is that studies on GnRH antagonistic treatments support their use as an additional treatment option. And recent data includes that post-operative medical treatment may be beneficial towards pain management and support a recommendation to offer it to all women not desiring immediate pregnancy. Treatment of endometriosis associated infertility is another topic which is not that easily understood. And the new recommendations are that the extended administration of GnRH agonist prior to ART treatment to improve live birth rate in infertile women with endometriosis is no longer recommended due to unclear benefits. The endometrious fertility index was added as a step in the treatment as it can support decision making for the most appropriate option to achieve pregnancy after surgery. As far as the recurrence of endometriosis is concerned, this is added as a separate chapter to highlight its importance and its challenges. The topic of endometriosis and adolescence was not included in the 2014 publication and has now been extensively covered in the 2022 publication. Same is true for endometriosis and menopause. In asymptomatic endometriosis, extrapelvic endometriosis, and primary prevention of endometriosis, there is no major change since the 2014 publication. However, there is much more extensive information in the area of endometriosis and cancer in the 2022 publication as compared to the earlier publications. With this, we come to the end of the video. If you like the video, then please subscribe, press the bell icon, share with colleagues and friends, write your comments, and press the bell icon after you subscribe so that you can be notified of future videos. Thank you and goodbye.